My name is Ed McCabe. I'm Senior Vice President and Chief Medical Officer for the March of Dimes. Joe, we want to thank you for your inspiring us on these commitments. The March of Dimes is a national organization with a presence in all 50 states, the District of Columbia, and Puerto Rico. Therefore, our commitments involve national public health programs focused on perinatal safety. Our partner in these commitments will be the initial March of Dimes Center on Perinatal Safety at UT Health and Memorial Hermann in Houston, Texas, led by Dr. Kojin Sao. Dr. Sao and I introduced the March of Dimes Center on Perinatal Safety at the Patient Safety Summit last year. The three commitments are to reduce non-medically indicated deliveries before 39 weeks gestation, optimize the administration of corticosteroids for impending preterm births, and maximize maternal immunization. Let's review these commitments one at a time. Our first commitment is to reduce non-medically indicated deliveries before 39 weeks. The March of Dimes and our partners have led a campaign for approximately 10 years to reduce early elective deliveries, meaning deliveries at 37 to 38 weeks gestation, by elective inductions and C-sections at early term before full term, which is 39 to 40 weeks. We did not have measures and accurate data on the rate of early elective deliveries at the beginning of this campaign. However, the most recent data, 12 months in 2015 to 2016, from both the Centers for Medicare and Medicaid Services, CMS, and the Joint Commission, determined that the rate of early elective deliveries was 2%. We calculated that preventing these early elective deliveries would prevent up to approximately 55 infant deaths annually. The Joint Commission also reported the rate of early elective deliveries in 2011 to be 14%, resulting in up to 385 infant deaths annually. In those 5 years, the national campaign had resulted in a net annual reduction of infant deaths by 330. This is the value of identifying best practices and developing a national campaign. Our second commitment I mentioned is to optimize the administration of antenatal corticosteroids for impending preterm births. Antenatal corticosteroids, when given to pregnant women appropriately, accelerate lung maturation in the baby and reduce neonatal respiratory distress syndrome, morbidity, and mortality. If antenatal corticosteroids would be used properly in all eligible women, then we calculate that this would prevent up to approximately 2,450 neonatal deaths annually. A recent study found that while overall only 38.8% of women receive antenatal corticosteroids appropriately, the rates varied significantly between hospitals, with rates ranging from 9.5% at the low to 50.9% at the high. We need more consistent utilization to reduce neonatal deaths and better metrics on the appropriate use of antenatal corticosteroids to know the numbers of lives saved annually by this intervention. Our third commitment is to maximize maternal immunizations. Immunizations of pregnant women for pertussis and seasonal influenza are safe and protect the mother, and by transfer of maternal antibody across the placenta, her baby. Available data do not permit us to calculate the absolute number of patients that would be spared harm per year from pertussis by this commitment. However, we do know it protects neonates from hospitalization with pertussis and results in shorter hospital stays, fewer ICU admissions, and less intubation and death. Immunization for seasonal influenza in pregnant women is associated with a 51% reduction in stillbirth. The CDC reported that only 49.9% of pregnant women received the vaccine in the 2015 to 2016 flu season. We calculated that immunization of the remaining 50.1% of pregnant women for flu would the 2016 flu season. We calculated that immunization of the remaining 50.1% of pregnant women for flu would, if we add the lives saved together for these national level commitments, then they would result in 7,005 or up to approximately 7,000 lives saved annually. We need national initiatives to save the lives of these 7,000 babies each year. We look forward to reporting back progress to Joe and the Patient Safety Movement Foundation in the coming year. Thank you for your time today.